Hi, I'm Dr. Will Holdsworth, your San Jose chiropractor from Pain Relief Chiropractic. Did you know that 80 to 90% of the general population will experience an episode of low back pain at least one point in their life? Young to middle-age, non-specific back pain is most common, and then when you get into your geriatric years, you're starting to feel the aging effects, so we call it the aging effects of low back pain instead of non-specific back pain, usually caused by degenerative joint disease, degenerative disc disease, spinal stenosis, which is like narrowing of the spinal canal where your spinal cord goes through. Also could be caused by osteoporosis and possibly fractures because the bones become so kind of like weak and brittle through the osteoporotic degeneration. The good news though is that it's kind of rare to have a serious reason for low back pain. Usually if there is a serious reason for low back pain, it's something like bladder control issues leading to cauda equina or indicating cauda equina, I should say. High temperature or a recent infection can indicate that there's a bone infection in the area. Unexplained weight loss, trouble sleeping, history of cancer, or a history of familial cancer can indicate that you may have cancer for the reason for your low back pain. And if there's any sort of trauma to the area, an x-ray would indicate if you have a broken bone as a cause for your low back pain, or if you have osteoporosis or you're an older patient, usually we'll do an x-ray just to rule out a fracture for that. So going to a chiropractor will help you identify right away whether or not it is something a little more serious. Once again, it is nice to know that they're more rare, these situations. The non-dangerous low back pain people, we need to make sure that we're moving. Gradually as we age, we move less, and I want everyone to remember that age is a state of mind. Just because you're a certain age doesn't mean you have to stop doing certain things. I remember like my grandpa and older relatives be like, I can't go on a hike with you, I can't go, I'm too old for that. Let me ask you a question. This is a pretty cool way of looking at age, is how old would you be if you didn't know how old you were? Think about that. How old would you be if you didn't know how old you actually are? Pretty cool. Age is just a number. Another thing that you may not be aware of is the surprising reasons that you may have low back pain. And one of the reasons that you may have back pain right now, if you're experiencing it, is because you're depressed or you're feeling down about something. When we're depressed, when we feel kind of, under the weather, not really feeling right, it disturbs our sleep, it disturbs our eating, it disturbs our posture, and you have to be kind of aware that that could be a trigger. It could be possibly your phone usage. When we look down at our phone, we're looking down like this, bending at our neck, looking down, hunching over. Some awkward postures can be involved with using your phone. Your feet may be causing the issue. When your feet hurt, you may be walking a little bit differently, so it's actually causing a pelvic imbalance, and that can be leading to the low back pain. Another one that could be a possibility is your core is just weak, and not to be funny, but this is actually the term pendulous abdomen is something that we use as a term for people who are overweight, who have a stomach that just sort of hangs there. That's extra weight that you don't need. You're just carrying around all these extra calories in the form of fat that's just stored in your body. Unless you're hibernating, there's really no reason to have that much fat on you, and that's just all that extra weight is just bringing you down. Do me a favor and Google search a skeleton of obese person or x-ray of obese person. You'll see that the skeleton looks nice and skinny, just like it should. You really should be without all the fat, but then it has all this extra tissue on the outside, and you're like, just because you're heavy doesn't mean your bones are going to change for the better. They're going to change for the worse. They're going to degenerate because of all that extra weight. The other thing that could be causing your low back pain that you may not even realize is you just have tight muscles. So go ahead and get stretching, especially the hamstrings, your hip flexors and quads, your psoas, even the calves, IT band, any of that sort of stuff. Your glutes too, another one. I have all these videos online on my YouTube channel and on my social media. You can go ahead and watch all those videos to learn the stretches so you can help get yourself out of back pain without even having to go see a chiropractor. That's it for me for today. I'm Dr. Will Holdsworth, your San Jose chiropractor from Pain Relief Chiropractic. Thank you so much for watching.